this is Iman. Welcome back to my YouTube channel on this beautiful Sunday. Today I'm going to present to you some very important variables in your life that makes your health outcomes statistically predictable. Therefore, your heightened awareness of these events or circumstances will change your attitude to help you have a hand in manipulating and enhancing your health outcome instead of the status quo of learned helplessness. According to CDC, Center for Disease Control and Prevention, social determinants of health, also known as Sdh, are the non-medical factors that dictates the outcomes of your health, such as life expectancy, quality of life. It is simple to understand that your quality of life is directly related to your health. Although disease pathophysiology may be well understood, the variables among people's health, their environment, and lifestyle shapes the trajectory and outcome of that disease itself. There is significant and profound impacts associated with social determinants of health over the person and the disease process itself. However, it does appear that there is opportunity for improvement to a certain degree, that our genetics is not a nail in the coffin. Below are social determinants of health as broken down by CDC. 1. Socioeconomic stability, which also means where you are located on the social and economic hierarchy or income ladder. This impacts health in multiple ways throughout one's life. Being born in a wealthy family automatically provides you with 10 steps ahead in life as compared to a person who is not born into a wealthy one. This is because you will not only have all your basic needs such as food, housing, and clothing met, but you will also have better quality of life than the person who is not. For example, wealth will afford you better education, networking, better health care, better job, and so on. Therefore, your health outcome is positively correlated to your socioeconomic stability. Number 2, access to education and quality of education. These two matter because education and quality determines your success in your academics and likelihood of being knowledgeable and getting great paying job to support oneself and family. Knowledge is power, and therefore you're more likely to use your knowledge to make better decisions to improve your health, such as consuming healthier food, engaging in health promoting activities, and steering away from risky behaviors. Access to healthcare and quality of healthcare. It is important to not only have access to health, but healthcare that meets one's healthcare needs. One way to acquire good healthcare in US is to have a stable job or income. As you can see, all these determinants of health are intertwined such that it is impossible to speak of one independently. And then number 4 is neighborhood or location. Your zip code will determine the trajectory of your health. Hard pill to swallow, but it's proven by multiple studies. Generally, this is how social class started long time ago, when there were only used to be two, which is the nobles and the peasants. Even back then, the two classes had clear separation, just as we do now. For one reason or another, we pretend it doesn't exist now, but it does. Based on your zip code, you either have access to well-funded public school, fresh, clean air, clean sidewalks with greenery, or you don't. The chances of you going out for a fresh air and relaxing walk is slim to none if your county hasn't proactively put that in place in your neighborhood. For the county to create any zoning or public health policy, it requires taxing the residents. And if the residents cannot afford high taxes or even basic taxes, then the residents in that zip code end up not getting the appropriate healthy environment. Number 5, social and community context. Social connection and support is a big deal, even in our great country that prioritizes individualism over socialism. We are psychologically wired to want to connect with others, especially the ones we share commonality. The rate at which we heal from any trauma, whether it's physical or emotional, it is dependent on the quality of support that we receive from our social support. These social determinants of health are additional variables to your existing demographics profiles such as race, sex, sex at birth, sexual orientation, age, and so on. Take a moment and think about how your own social determinants of health and demographics is applicable to you at this very moment in improving or undermining your overall health outcome. They all collectively have consequences. Have you thought about how any of these social determinants of health affect your health? If so, comment down below and share. This is definitely not a social justice class, but it does tie to exercise and weight training. Now again, ask yourself, how does my social determinants of health and demographic affect my weight training, especially if you are currently not on any exercise regimen? Can you connect the dots? If not, I'm happy to help. Again, comment below. Thanks for watching. Ciao.